From Homeyer and Sweeney, Sanddtray Therapy, a Practical Manual, Chapter 2. Some History and Rationale. Clients of all ages and family configurations yearn for a place in which to express and process their pain. For many of them, the prospect of psychotherapy is enormously daunting. To verbalize issues means to confront fearful emotions. Even the most cooperative client must deal with this confrontation. Therapists are faced with this reality, both personally and professionally. Sanddtray therapy provides a place for this often intimidating process to occur. We are convinced not only of its efficacy as an intervention, but of its quality as a place of retreat for clients in pain. We would like to briefly discuss the history of sanddtray therapy and then list several rationales as well as practical benefits for the use of sanddtray therapy with individuals, children, and families. A brief history. Margaret Lowenfeld first developed the therapeutic use of the sanddtray in miniatures in the 1920s. She had read G.H. Wells' book Floor Games, in which Wells talks about his elaborate playing with miniature toys on the floor with his two sons. Lowenfeld adapted this concept in her counseling institute, using metal trays with sand and water and miniature toys in boxes. She would ask her child clients to combine the materials to create world pictures. This technique would come to be called the Lowenfeld World Technique. Play therapy was concurrently being developed and utilized, beginning with Sigmund Freud's case of Little Hans, and later work with Ermine Hug-Helmuth. Around the time that Lowenfeld was developing her approach to sanddtray therapy, Anna Freud and Melanie Klein were beginning to work and write about their work in play therapy. Freud saw play primarily as a means of forming a solid therapeutic alliance with a child client, while Klein believed that play could be used as a substitute for verbalization, replacing the psychoanalytic technique of free association. Working with children using the sanddtray was expanded and popularized by the work of Dora Kalf, a Swiss Jungian analyst. Kalf learned of Lowenfeld's work and adapted the method, calling the approach sandplay. As noted in Chapter 1, the term sandplay refers to the Jungian approach, although it has been widely used outside of Jungian circles. Kalf acknowledged Lowenfeld's important contribution. Quote, "She understood completely the child's world and created with ingenious intuition a way which enables the child to build a world, his world, in a sandbox." It is interesting to note in the broader field of play therapy that Lowenfeld and Kalf are rarely mentioned in the historical timeline of the developing field. Sanddtray therapy certainly is a play therapy approach, and we would put forward that the pioneers in sanddtray therapy deserve recognition in the broader view of play therapy. There are many approaches and nuances in both the theoretical and technical approaches to working with clients in the sand, ranging from the traditional Lowenfeld approach in Jungian sandplay to Gestalt methods and cognitive behavioral approaches. Each of these and others has therapeutic value. Both of us are therapists and counselor educators. If we can put on our professor caps for a moment, we'd like to make a comment about counseling theory. As educators, you would expect that we value theory, which is certainly the case. However, we would argue that for being theoretically based, not theoretically bound. One can use a variety of techniques, in other words, but be technically eclectic. We have concerns, however, about being theoretically eclectic. Theory alone is inadequate. In fact, theory without technique is merely philosophy. The opposite is an equally important concern. Technique without theory are reckless, perhaps even dangerous. Okay, off with the professor caps. Therefore, we strongly encourage the interested reader to seek ongoing training and supervision in sanddtray therapy with an approach that resonates personally and theoretically. Please refer to the suggested reading list in Appendix C. Why use sanddtray therapy? A rationale. As experienced sanddtray therapists will attest, there are many benefits for both clients and counselors. Similar to other expressive and projective treatment modalities, sanddtray therapy provides an important medium to reach hurting clients. We would therefore like to summarize some of the main rationales and benefits for using sanddtray therapy. Sanddtray therapy gives expression to non-verbalized emotional issues. Since play is the language of childhood, as well as a language for a client of any age who is unable or unwilling to verbalize, the sanddtray provides a safe medium for expression. If play is the language, then the miniatures are the words. Just as an empty canvas provides a place for the artist's expression, so the tray provides a place for the client's emotional expression. The client needs no creative or artistic ability, since the medium provides an experience that is free from evaluation. The self-directed sanddtray process allows clients to be fully themselves. Through the process of sanddtray therapy, which includes a caring and accepting relationship, children and families can express their total personality. This enables hurting clients to consider new possibilities, some of which are not possible through verbal expression, and thus significantly develop the expression of self. Sanddtray therapy is, therefore, more than a symbolization of the psyche. It is a form for full self-expression and self-exploration. Sanddtray therapy has a unique kinesthetic quality. We have already reflected on the sensory quality of sand and play, and the need for a sensory experience for clients in distress or crisis. Sanddtray therapy provides this sensory experience and meets the need that we all, not just our clients, have for kinesthetic experiences. This fundamental, an extension of very basic attachment needs, is met through relationship and experience. Sanddtray therapy provides both of these elements for clients. The very tactile experience of touching and manipulating the sand is a therapeutic experience in and of itself. We have frequently had nonverbal clients who have done nothing more than run their fingers through the sand, resulting in the ability to talk about deep issues. It is as if the sensory experience with the sand causes a loosening of the tongue. While this has not been the intent or goal, it is certainly a therapeutic byproduct. The manipulation of the sand and placement of the miniatures is both safe and kinesthetically satisfying, especially for clients whose prior sensory experience was noxious. Sanddtray therapy serves to create a necessary therapeutic distance for clients. Clients or families in emotional crisis are often unable to express their pain in words, but may find expression through a projective medium such as sanddtray therapy. It is simply easier for a traumatized client to speak through one of the sanddtray therapy miniatures than to try to verbalize their pain. The consistency of the medium and the consistency of the therapist in allowing the client to direct the process creates a place where the client establishes the degree of therapeutic distance. Children, adults, and families in sanddtray therapy may experience emotional release through symbolization and sublimation through the projection onto the tray in miniatures. The therapeutic distance that sanddtray therapy provides creates a safe place for abreaction to occur. Children and families that have experienced trauma need a therapeutic setting in which to abreact. A place where expressed issues can emerge and be relived, as well as to experience the negative emotions that are frequently attached. Abreaction, a crucial element in the treatment of trauma, finds facilitated expression. Sanddtray therapy is an effective intervention for traumatized clients. In addition to the needed safety that is provided for sanddtray clients through the expressive and projective nature of the intervention, there are neurobiological effects of trauma that point to the need for nonverbal interventions. The sensory nature of trauma may best be addressed through a sensory intervention, such as sanddtray, and the neurobiological inhibitions on cognitive processing and verbalization point to the need for an expressive intervention. This has already been briefly noted and is expanded upon in Chapter 10. Sanddtray therapy with families is a truly inclusive experience. As noted, an adult talk therapy approach to treating families is decidedly exclusive as it fails to recognize and honor the developmental level of children in the family. Sand-tray therapy with families overcomes this obstacle. Sand-tray therapy creates a level playing field for every family member, giving each person the opportunity to express him or herself. Keith and Whitaker include play therapy interventions as an integral part of the family treatment process, including fundamental family therapy. Fundamental family therapy takes place at this nonverbal level. For example, it can be very threatening to ask a child to detail the communication patterns in the family through words. It can be equally threatening for any member of the family who feels isolated or disempowered. But put simply, it is taboo to air the dirty laundry, especially to an outsider. Family members aren't supposed to talk about problems. Perhaps the sand-tray therapy miniatures can. The typical family sculpting exercise, which can be overwhelming for children to do in a family session, may easily be replicated in the sand tray. Like puppet play, sand tray therapy can create an unrealistic and non-threatening atmosphere that assists in the identification process, thereby encouraging the projection of emotional aspects and interpersonal relationships through the characters. Chapter 8 provides specific detail in working with couples and families with sand tray therapy. Sand-tray therapy naturally provides boundaries and limits, which promote safety for the client. Boundaries and limits define the therapeutic relationship, as well as any other relationship. Sweeney suggested, quote, "A relationship without boundaries is not a relationship. Rather, it is an unstructured attempt at connection that cannot be made because the people have no specific rules for engagement. A world without limits is not a safe world, and children do not grow where they do not feel safe." The careful structure of the sand-tray therapy process and the carefully selected tools of the sand-tray therapist provide the client with the boundaries that create the sense of safety needed for growth. The size of the sand tray, the size and selection of miniatures, the office setting, and the guidance and instruction of the therapist all provide boundaries and limits for the client. While these limits are imperative and intentional, they promote freedom for expression. These inherent limits to sand-tray therapy bring a focus to the therapeutic process, which, in addition to promoting the safety that boundaries bring, assists the client to focus on the therapeutic issues to be addressed. Sand-tray therapy provides a unique setting for the emergence of therapeutic metaphors. There is an increasing amount of literature on metaphors in psychotherapy, much of which focuses on verbal metaphors. Siegelman suggested that metaphors combine the abstract and the concrete in a special way, enabling us to go from the known and the sensed to the unknown and the symbolic. They achieve this combination in a way that typically arises from and produces strong feelings that lead to integrating insight. Metaphors can indeed be therapeutically powerful. We would suggest that the most powerful metaphors in therapy are those that are generated by the clients themselves. Sand-tray therapy creates a consummate setting for this to occur. The sand and miniatures are ideal for clients to express their own therapeutic metaphors. Where therapeutic metaphors emerge, therapeutic interpretation naturally follows. We would echo Kaff's warning against focusing on interpretation, recognizing that it is the client's interpretation that is the most important. We would further suggest that interpretation of sand trays is not essential to the healing process, and often need to remind ourselves that when we interpret, we do so with our own minds and experiences, not the client's. It is a helpful reminder that when interpreting a client's expression of an experience, that the sharing of the interpretation is meant to serve the needs of the client and not those of the therapist. Sand tray therapy is effective in overcoming client resistance. It is important to remember when working with children and families that involuntary clients are the rule of thumb. Children generally do not self-refer, and not all family members are enthusiastic about entering therapy. Sand-tray therapy, because of its non-threatening and engaging qualities, can captivate the involuntary client and draw in the reticent family member. Since play is the natural medium of communication for children, child clients who have been compelled into therapy by an adult are generally amenable to treatment because they are being allowed to express self through play. For the resistant individual or family member, sand-tray therapy provides a means of communicating that diverts the fear of verbal conflict. With couples, for example, it is not unusual for one partner to be less enthusiastic or even reluctant to participate. Related to this, the level of contribution that each family member makes to the construction of the sand tray may be a reflection of his or her investment in family. In this regard, resistance can not only be overcome by sand tray therapy, but more fully identified as well. Sand tray therapy provides a needed and effective communication medium for the client with poor verbal skills. Beyond the developmental importance of providing children with a nonverbal therapeutic medium, there are clients of all ages who have poor verbal skills for a variety of reasons. Poor verbal skills include clients who experience developmental language delays or deficits, clients with social or relational difficulties, clients with physiological challenges, and more. This includes clients who use English as a second language. Many bilingual clients prefer to express themselves in counseling in their first language. Sand tray allows for expression of deep and personal issues in a common symbolic language. Just as the toddler who wants something desperately but cannot communicate this to the parent, so anyone can have a great level of frustration when unable to effectively communicate needs. When the toddler has a tantrum because he cannot communicate his want or need, there is a vivid challenge between the parent and child. In the same way, relationship challenges of many types emerge in families when people are not able to verbalize their wants and needs. The sand tray therapy process creates a place where expression of needs and wants is not dependent upon words. The client with poor verbal skills, regardless of its etiology, finds a place of relief in sand tray therapy, a place where expression does not depend on verbal acuity, but on the freedom of the medium. Conversely, sand tray therapy cuts through verbalization used as a defense. For the pseudo-mature child, who presents as verbally astute, yet is developmentally unable to effectively communicate on a cognitive level, sand tray therapy provides a means to communicate through the child's true and natural medium of communication. For the verbally sophisticated adult who uses intellectualization and rationalization as a defense, sand tray therapy may cut through these defenses. This is an important dynamic to be aware of, since a family system, which includes a verbally well-defended member, may also include one or more members unable to establish effective communication and relationship. The nonverbal and expressive nature of sand tray therapy identifies this dynamic and provides a nonverbal way to address it. Sand tray therapy creates a place for individual, couple, family, or group clients to experience control. One of the primary results of crisis and trauma is a loss of control for people in its midst. The loss of emotional, psychological, and even physiological control is one of the most distressing byproducts of crisis and conflict. Both the individual and family in crisis feel the frustration and fear of having lost control. A crucial goal for these clients must be to empower them, following any personal or family trauma that has been disempowering. The self-directed process of sand tray therapy creates a place for control to be returned to the client. For the client looking to attain and extend self-control, sand tray therapy establishes the boundaries and allows the freedom for this to occur. For the client attempting to avoid responsibility, the sand tray therapy process places the responsibility for and control of the process on the client. If a goal of therapy is to help clients achieve a greater internal locus of control, sand tray therapy is an effective means toward this end. The challenge of transference may be effectively addressed through sand tray therapy. The presence of an expressive medium creates an alternative object of transference. Lowenfeld proposed that in the creation of worlds in the sand, transference occurred between the client and the tray, rather than between the client and the therapist. Weinrib noted that the sand tray often becomes an independent object, so that the child may take away images of the tray rather than the therapist. Regardless of one's theoretical view of transference, however, sand tray therapy provides a means for transference issues to be safely addressed as needed. The tray and miniatures may become objects of transference or the means by which transference issues are safely addressed. Lastly, deeper intrapsychic issues may be accessed more thoroughly and more rapidly through sand tray therapy Access to underlying emotional issues and unconscious conflicts is a challenge for any counselor. Although certainly not a comprehensive list, the qualities of sanddtray therapy that have been suggested generate an atmosphere where deep and complex intrapsychic issues can be safely approached. Most clients have some level of motivation to change, as reflected by their presence in psychotherapy. Most of these clients likewise are often well defended when confronting challenges to their ego, which has already been injured. Sanddtray therapy serves to decrease ego controls and other defenses and foster greater levels of disclosure. This in turn creates an increased capacity to consider interpersonal and intrapersonal alternatives. Bonnie Badenoch discussed the broader perspective of sanddtray therapy and the brain. Badenoch indicated that use of sanddtray awakens and regulates the right brain limbic processes, promoting vertical integration in the right brain. New neural pathway templates are developed, effectively rewiring dysfunctional, painful memories. Badenoch indicates that touching the sand activates the brain. The sensations travel to the prefrontal cortex, which makes sense of tactile input. The counselor and client stay attuned during the building of the tray, according to Badenoch, through right brain resonance. Additionally, when the client recalls painful experiences and is met with empathy and kindness, new synapses carry that information throughout the brain, and blood flow changes course to more soothing paths. Once the tray or world is created, verbally discussing the contents results in left and right brain integration.